Good evening, good evening, good evening, and welcome to Mental Health Moments with Dr. Rhonda Mattox. I'm Dr. Rhonda Mattox. Thank you so much for joining us as we talk today about strategies to find mental health professionals wherever you are. Family, there is no time when that has been more important than right now in the middle of the COVID-19 pandemic. After the pandemic hit, the World Health Organization estimated that there was a massive 25% increase in the prevalence of anxiety and depression in one short year. We have concerns about our mental health, and it's prompted us to make sure that we connect with service providers sooner rather than later. As we've heard the likes of people that we know and love talk openly about the issues that they're having, from our former First Lady, Michelle Obama, to our beloved Meghan Markle, Duchess Meghan Markle, we have enjoyed to some degree knowing that we're not alone, that we're not the only people who have taken a hit in this. As you decide to realize and show yourself some grace for and recognize that it's okay to not be okay. It's also important for us to not be okay for too terribly long. We want to make sure that we're working and talking with people who can help us work through some of the stress, the ambivalence, the guilt, the anger, the shame, the whatever it is that we have been struggling to come through. Now, many of us prior to the pandemic, we talked about going to our friends. We talked about a good girls' night out. But as most of you know, all of us were hit. Our superheroes wearing their superhero capes, who were the people that folks traditionally went to when there was something wrong. That might be your doctors, your teachers, your nurses, those individuals that perhaps you could kind of pull their coattail and share with them. Perhaps the other word is dump onto them. Those individuals have had loss after loss after loss, and perhaps they don't have any emotional reserve to check in on their friends like they used to. If you are feeling like you are all alone and you feel a little bit guilty sharing those things that are going on with you because you know your friend has been battling through uphill battles at work or parenting struggles or family relationship dynamics and you don't want to share with them, now is really a great time for you to consider seeking out a mental health professional. Now, many of the barriers that kept people away are no longer relevant. You don't have to park your car a distance and walk to the clinic so no one sees your car in the parking lot, nor do you have to worry about who's going to see you in the waiting room. One of the perks, one might say, of the pandemic is now telehealth and telemedicine is at our fingertips. And we literally do not have to leave the house in many instances in order to get the treatment we deserve and that we need. When you finally decide, okay, now it's time, I'm ready for the services, there's this next question of, oh my gosh, where do I turn? And that answer is fairly simple. Start with asking for referrals. You might ask your family medicine doctor or your pediatrician if this is, for your child, who would they recommend? Many times they have to refer out frequently. And so they've heard from their patients in abundance who's really good in the field and who's not. So you might just start with your doctor and who they've worked with. The other piece is you can call your insurance company and ask for psychiatrists or therapists that are in network that are accepting new patients. The other piece is you might contact your state medical association and ask for members of a particular field. I've never done that before and I don't know. Certainly, if you're in Arkansas, you can go to amdpa.org. I'm the president of the Arkansas Medical, Dental, and Pharmaceutical Association. You can go to our organization and type in that and ask the question, who is a psychiatrist or a therapist that you might recommend? And they're likely to direct that to one of our mental health professionals in the organization and give you those answers. The other piece is if you are employed, you can contact your human resource officer at work and ask about employee assistance programs. Those programs tend to be maybe 4 to 8 sessions that are free of charge for their employees. They've already negotiated with mental health professionals in the community, and they are happy to connect you. You may, at the completion of that, be done and not need any additional services. If not, many times those professionals have relationships with people in the community, and they can direct you into the community for continued treatment with people who have expertise in your area. And finally, consider directory resources like Psychology Today or Therapists for Black Girls or something along those lines, so that you can then see a bio, perhaps a picture of the individual, and you can get a feel for if that person is right for you. Many times you can type in your zip code and they will have outlined what insurances they accept. So you don't even have to do the legwork of calling and finding out, do you accept my insurance? They'll have it right there in black and white, whether they accept your insurance or not. Family, I hope that these tips on how to find a therapist or a psychiatrist and mental health professional that is accepts your insurance and that is perhaps right for you helped. Godspeed. Bye-bye.